So now we're going to go over lumbar mechanical traction. So I'm going to show you on the same machine that we did cervical traction. For lumbar traction, you need both sets of lumbar harnesses. So there's a smaller set that looks like this. They're sort of bean shaped. These are your thoracic harnesses, and these are going to go at the head of the table. And for this is where the patient's head is going to be. Then you also need a set of these larger harnesses. These are your pelvic harnesses. These are going to go down on the lower end of the table, and this is how we're going to pull traction. So the idea is that the thoracic harnesses are going to hold onto the ribs, and the pelvic harnesses are going to hold onto the hips above the iliac crests. And when they pull, that's what's going to cause the separation in the lumbar spine. I personally like to attach the thoracic harnesses to the table before I have the patient position themselves. You can put both sets of harnesses on the patient before they lay down. You can put both sets of harnesses on the table and then have the patient lay on them. There's really no right or wrong. It's just preference. So the thoracic harnesses, you're gonna open them up, lay them on the table, and like I said, these are gonna attach. There are hooks underneath the table here that will come up and attach into each of these D-rings that are on the harness. When you position these, you do want to try to take up all the slack in these harnesses. So I usually start by pulling them down as far as they can go. If you don't have these pulled down as far as you can go, as soon as you start traction, it's just gonna give your patient a little ride down the table. So I'll have my patient come on over. I'm gonna take the pelvic harnesses, and just to make it a little bit easier, I'm gonna attach these to her before she lays down. That way I only have to try to steady this set that's on the table. So these, again, you want to make sure that they catch over top of the iliac crest, and you can have the patient, could you just sort of hold those in place right there for me? And again, make sure we're over top of the crests there. Ideally, these are going to line up right on the lateral side of the patient, and evenly too. You want to make sure they're pretty symmetrical there. So those look okay. I'm going to have you carefully hop up on the table. I'm going to lower the table a little bit here just to make it a little easier for my patient to get on. For lumbar traction, it doesn't matter as much the height of the table. It matters the position that you put the patient in. So we're going to hook up supine traction, which is going to put the spine in a little bit more flexion. You could also set up traction in prone, which is going to put the spine in a little bit more extension. So I'm gonna have the patient go ahead and lie back. What I want you to do is try to line up this harness with the bottom of this harness. All right, so before we start to tighten all them up, I'm gonna have you put these on like a nice little pair of suspenders. And I'm gonna attach the thoracic harnesses now. And again, these should be right on the side of your patient. Now, if you can scoot your whole body down this way at all, good. There shouldn't be much because we should have already had a pretty good amount of tension on there. The last thing I'm going to do is tighten them, because when we tighten them, we really tighten them. So I'm going to go ahead and finish positioning my patient. I'm going to put her feet up on the stool. For supine lumbar traction, you have to use the stool, otherwise their feet are going to get all tangled up in the harnesses here. You will also need one of these spreader bars to attach the harnesses to, so I'm just going to have that here and ready. So I'm going to grab the stool. We're going to put the patient's legs up on that. Do keep in mind our patient is being very helpful right now. A lot of your patients with low back pain are probably going to need some assistance to lift their legs up like that for you. So once her legs are up here, I'm going to attach the pelvic harness to this spreader bar. And I'm going to come over here to the machine, rope release, get myself some rope, attach it here, and then try to take up the slack. Now I'm going to come up here and I'm going to tighten down my harnesses. These harnesses have to be very snug on your patient. If they're not tight enough and this machine starts to pull, it's just gonna pull the harnesses right off of your patient. So I'll usually start here with the pelvic harness. You need to take up all the slack here. Can you breathe? Still?
Yeah.
Okay. I will usually take a pillow too, fold it in half. How's that? Good. Okay. All right, so those seem pretty snug. She's all set. There, we've got our attachments down here. So I'm just gonna go ahead and put my settings into the machine. Again, I'm gonna decrease my steps first. For lumbar traction, our max pull should be about half of the patient's body weight. So we're gonna go ahead and put that in, and then my minimum level I usually put at about half of the max. Hold time and rest time you can change too. This time, just for fun, we'll do 30 and 10. We'll give the patient the emergency shut-off button, and then we're ready to go. So we'll just hit start. A safety feature built into this machine is that I have to confirm that I'm doing lumbar traction. Any pull over 39 pounds, it makes you confirm that you're not gonna try to pull on someone's neck that hard. So I just have to hit the lumbar button and the machine will start to pull. For lumbar traction, I will also unlock the table. These are split tables. The reason for that is you'll see most likely when traction starts to pull that the table will start to gap a little bit. This just helps to decrease friction so that it's not just pulling your patient down the table. You might hear a little bit of rubbing between the leather harnesses and the leather on the table, but other than that, this is what your lumbar traction should look like. So again, we're up to about half of our pull. How does that feel? Pretty good. A little bit of a stretch?
Yep.
Okay. Shouldn't be too much. They should definitely feel a stretch at this point, but it shouldn't be overwhelming. So we're at about a quarter of the body weight at this point, and then we'll go the rest of the way up to half in just a couple seconds. So we have about 8 seconds remaining. Again, you'll stay with your patient through a cycle or two just to make sure that they're comfortable with this. With lumbar traction, again, the pain relief, reduction of radicular symptoms should be almost immediate. Your patient should tell you that they feel better, they feel more comfortable on this. If they're not, this might not be the best thing to do with them. Okay? Mm-hmm. It is a little awkward. There's a lot going on here. So we're at our max pull. How's that feel?
Good.
Okay. So she's good there. Again, same thing. You can go in, you can hit your max pull and make any adjustments up or down if you need to. Again, when treatment is over, we'll take our patient call button back. In a perfect world, I will hopefully my patient can stay here for a minute. At the very least, I'm gonna undo these harnesses right away and let them breathe. Again, if she's got an extra 2, 3, 5 minutes, I'll just let her lay here. Because what happens is we've just stretched out the spine. As soon as she goes and sits up and stands, we're gonna load that spine again. So the longer we can just kind of leave her here without any of that loading tension on her spine, hopefully the better she'll feel. So we'll help. Actually, before we do that, let's get the rope out of the way here. And then we'll move your legs. So she needs help with that. We can help her out. And again, same thing with this. Now with this table, because it was opened, I am gonna try to push it back together and lock it. The gears in here have stripped over the years, so when it's locked, it's not truly locked. So this part of the table could slide when the patient goes to move. I usually just stand here with my leg against the table and let the patient roll to their side and then sit. And then again, at this point, we'll reassess the patient, determine how she did with treatment, and then if we need to make any changes for next time.